Hello, everyone, and welcome back to the Pain Free for Life podcast. I'm your host, Dr. Rob Van Bergen, and today we're doing my favorite podcast episode for the month of May, and this is our Q&A. Now, for those of you who don't know how this works, people are able to submit questions for the Q&A by both email and also by our Facebook polls that are posted each month. And the top 5 questions, at least, make it into the podcast episode. I answer them live. I actually get given them right before I record this. And in this case, I haven't even actually taken a look at what actually came in. So I might get a surprise. Hopefully it's something that I can answer even if it is a surprise.
Welcome back to Pain Free for Life, where we share how to successfully overcome all kinds of chronic and extreme conditions to live happy, productive, pain-free lives forever. And now, here's your host, co-founder, and board-certified holistic healthcare practitioner, Dr. Rob Van Bergen.
So let's dive in and get your questions answered. So first and foremost, we have this question here. What are the most common mistakes beginners make with microcurrent therapy, and how can we avoid them? So it's a nice general question looking at what exactly is going on here and how we might be able to avoid these mistakes. So I think that the number one mistake off the top of my head is going to be getting hung up on dosing and zeroing. So if you read your device manual, you'll see there's a section in there on DZS, or dose, zero, stimulate. And I think that the biggest thing that can happen here is that people can think that that's the only way they're going to get healing happening. And so they'll end up dosing and zeroing way more areas on the body than they ever need to. The way you kind of want to view dosing and zeroing is it's the way of your brain pointing to an area and saying, hey, this is what needs to be treated. This is great, but you don't want to overdo it. If you're doing it all over the place, you're just going to create a lot of confusion. And so you're going to end up causing yourself issues where you're just not getting the healing response you'd get if you just did one dose and zero. I think another really common mistake is over-treating. There seems to be this belief in more of something is better, and that's the opposite with microcurrent. Generally, less is more. So if you're really looking to avoid, really maximize, I guess, your benefits with the device, you're going to want to bring it into a less is more approach. And this is reflected in a lot of our new protocols where we're often talking about 3 to 5 minutes. If you're looking at some of our older training videos, like really old ones, you might see treatment times in there recommended of 20 minutes and 30 minutes. These are really only recommended for wounds and with PEMF. Most of the time, these sorts of timings are just too much. They're just not necessary. It's not going to hurt you, but it's not going to give you better results than if you just did a short treatment. So optimize your time in that way. I would say, let's go with another mistake here. I would say is that people don't follow consistent treatment plans. If you're going to be doing vagus nerve stimulation, try and keep it consistent. Being like, well, I did vagus nerve for 2 days and then every time I was supposed to, and then I missed a day. Then the next day I did it once instead of 4 times. Then I got back to my pattern and I'm not really seeing results. I mean, the writing's on the wall there. You've got to follow the plans. Especially with something like vagus nerve, we're trying to train the body to actually stimulate the vagus nerve itself. And if we don't stick to that schedule, we may cause more and more issues. Other mistakes would be things like, as you're getting your technology ready, if you're using the 8-inch Y probe that has Avasia written on the handle and you don't use the Y sleeve, well, that can cause some problems with the wires. So definitely recommend following those instructions too. And I guess one of the biggest ones I could see would be people aren't utilizing the resources, especially because this is for beginners, that are available to them. Everyone that gets a device has a treatment coordinator, and your treatment coordinator will build you a personalized treatment plan. And The people that don't see the success right away are the people that just kind of jump in and try it themselves. There's a lot of nuance to creating a plan and to making sure that it works for you. And if you follow the plan, you'll see the success more often than not. And so when I see people that are like, this isn't really working for me, or what can I do differently? And then you look and they're not really following the plan at all. The answer again is kind of evident in that way. So hopefully that answers that question. I suppose I could keep going on different things, but those are the most common ones, I would say, outside of thinking your device doesn't work and not putting the batteries in it. That's definitely one of them too. Okay, so the next question, how does pain relief through microcurrent evolve as the body heals? And what should we expect? Okay, so pain relief, when you're initially treating, is likely going to be higher than it will be over time. That's my experience. So the first treatment or two you do on an area is going to give you more relief than future ones. And this is the typical approach because usually what you're seeing is the immediate intaking of the body with the microcurrent and the shutting down of the pain signals, a reduction of inflammation. And then you're going to start to see that each subsequent treatment has less to take away. And you're often dealing with degenerative damage and pain at that point. The other piece of the puzzle here is that some people will feel worse after their first few treatments. This is the same with anything. It's not a side effect, but it's more of a way your body is trying to process and react to the issues at hand. And that's one of the biggest challenges I think people try to overcome is this idea that, well, I'm treating and it made me feel worse at the beginning. And so then they resist treating further. It's kind of like, starting a new supplement regimen or a detox regimen that makes you feel crummy at the beginning, but at the end is going to make you feel good. Is it common for that to happen? No. But does it happen? Yes. And I think there's that evolution of at that point, as you continue treatment, you have to get past that initial body reaction and then get to the benefits afterwards. So it can kind of go either way. But in my experience, when treating most patients, typically that initial treatment is going to provide more change. And then after that, we've got less change to do, right? We've had a pretty dramatic and immediate shift. And that's kind of the concept of pain relief in a nutshell. It will always be individual. Everyone will have a different experience with their pain. And I think just setting your expectations to be that typically treatment to resolve things is going to be something that we're working towards and that we're starting with that relief, which we might see more evidently. But resolution of pain is not something that happens overnight. Do we see that? For sure, we do. We see people that have individual treatments for the first time and then all their pain's gone, that do vagus nerve once and solve their EMF sensitivity. These things do happen, but it's not the normal, right? The normal is that we would expect to see people having a kind of potentially it gets a little bit worse before it gets better, but also a treatment timeline towards resolution. It's not going to just resolve overnight in most cases, but you will notice differences as your body is changing. And it's important to reflect and to check in on those differences too, because it happens with patients all the time. And the treatment coordinators will tell me this. They'll be working with a patient who then will say, I don't think it's really making any difference. But then when they actually do a check-in with themselves and they look at what things happened before, like how they weren't able to sleep before, but now they're sleeping better. How they weren't able to eat without getting a stomachache and now they can. It's the subtle differences as their body's starting to repair and heal and move towards that pathway of resolution. Okay, the next question here is there a protocol for people that have high histamine issues? So yes, there is, and it's going to kind of be cobbled together from a few different things. First is always going to be vagus nerve stimulation because it will calm the body down almost regardless of what's going on. And so stress and things like that can activate a high histamine problem. The other thing will be to do the root protocol. So this is the one that looks like a spiral and it's on your abdomen and you kind of end up spiraling out as you go. And to work on treating the liver. I think more times than not, the liver itself is really intertwined in histamine reactions. And we need to make sure the liver is healthy and functioning properly to get those results that you're looking for. So that's kind of the main approach that we would want to take there. Now, this is, it's not always going to be a quick process, but I think that the best way to do it is going to be to work on the vagus nerve to resolve them. And then there is something I don't talk about too often, which is working on the adrenal glands too. So the adrenals sit on the top of the kidneys, and sometimes we want to stimulate those when we're dealing with high histamine issues. It won't necessarily fix them, but it will help to mitigate them when they're in that state. So working with a Chi Wave pad behind your back, working on that area with like a Sanasoft T, with that 90 hertz frequency to kind of boost things up. Or if you're using the direct microcurrent and you've got someone to help you out, get your adrenals dosed and zeroed and essentially stimulated. We want to kind of get them producing some adrenaline to help battle the high histamine as well. Okay, so the next question, what mistakes do people often make when they don't see fast pain relief with microcurrent? So this kind of ties into what we talked about already with the body healing, but I think it is a time thing, right? I think people are spending a lot of time treating sometimes when they get this device out of the box, and they often make themselves just not really get those results. If you're taking the device and you're painting the area for 15 minutes, it doesn't have any more of an effect than doing less. And we even see less is more. Shorter microcurrent treatments are better at triggering healing in the long run. So that's ultimately the best way to approach it, I think, is just to take it kind of in that low amounts of treatment time so that you get the benefit over time. I think the other thing is potentially using the wrong frequencies. There's some people that get hung up on the kind of generic nature of frequencies and thinking, well, 7 to 12 hertz, for example, heals. And it does. It is a healing regenerative frequency. It's our alpha state, but it's not anti-inflammatory. Anti-inflammatory is anything above 100 hertz. So you want to use 121 or 350 to deal with pain. And then you have to look at the other side as well and think, well, okay, if the pain reduced a bit, but it's not fully gone, is the remaining pain due to long-standing inflammation? If I've damaged my elbow and it's inflamed and hurting, well, then I can get rid of the inflammation and the pain can go down. But if it's been a long time, there's still tissue damage in that elbow, right? There's potentially bone damage, there's muscles, tendons, ligaments, all these things could be damaged. And so then using a regenerative frequency like 7 to 12 hertz is going to be very beneficial too. I think that getting willing to look at the different modes and theorize about the different concepts is great because, yes, the inflammation is the root cause of pain, but the damage done can create this kind of concept of degenerative pain where the body is just not able to function as well because it's been damaged. And we need to look at fixing that too. So there's a few things to try there for sure. Okay, so our last question for this episode came in on the poll, and it's a specific protocol for looking at a specific condition. And so this question says, what is the protocol for treating osteitis pubis, and what are the common causes? Okay, so this one is kind of going to be a bit of a challenge because I hadn't really heard of this condition before. So this is what I mean. Sometimes it can come out of left field and surprise me. But if we think about the name, we also have to kind of break down these Latin names. Osteitis is generally going to be, well, itis is inflammation, and oste tends to be joints or bones. And then the pubis is probably the pubic symphysis, which is going to be kind of where the two pubic bones meet. So what we are left with in this case is an inflammation of the pubic symphysis area and typically affecting the bone. So this would create kind of significant pain in the pelvic region, and maybe I guess it could radiate up into the abdomen or down into the legs. So there's quite a few things to unpack with this condition. So first off, it will be this inflammation. So there will be inflammation there that needs to be addressed before we can fix anything else. So use 121 hertz. Use 350 hertz. Use blue stimulation. Whatever you have that goes into that anti-inflammatory range. Work out the active zones around it. These are those sticky spots you'll feel when you're treating, where the device gets stuck. Get those broken up by moving the device over those areas. This will lead to pain, right? So the pain, this condition will lead to pain, not the treatment. So the pain is going to be there, but the inflammation, part of that symptom of that is pain. And so this is kind of a thing that shows us that inflammation is present. So as the inflammation goes down, the pain should go down too. The biggest concern with this condition would be a long-term damage to the tissues. So again, we're kind of talking about the musculature and the joints. So there's different frequencies that you're going to want to look at depending on where exactly this has impacted the most. For joints, the ideal frequency program would be our fMRSI program. So that would be what I'd recommend using on there. And then I would probably also follow that up with some 7 to 12 hertz if you've got that, because it will give you kind of a more broad regeneration of muscles, tendons, ligaments, bones. So it's going to kind of make sure that between that and the joint one, we cover all of that potential damage. fMRSI also increases circulation by a significant amount too, which helps the body to heal. So again, a multifaceted protocol, anti-inflammatory to regenerative. This is always going to be the case. If this is a long-standing condition as well, I would first treat for scar tissue. Making sure you clear and neutralize any scar tissue is going to give you the best chance of the microcurrent really taking hold in the body. So yeah, it's kind of your standard protocol, but it needs to cover everything on the regenerative side. Just remember, you won't be able to heal if you don't get rid of the inflammation first. So the inflammation should always be the starting point of your treatment protocols. All right, so that brings us to the end of our Q&A episode for May. So very excited to continue to do these. Please keep submitting your questions. It's what keeps us going. It's very fun to be able to look and help people in this platform. And we can get some other people help too, because I feel like a lot of these questions here today and in other episodes are questions other people are thinking. Maybe they're just not asking them. So it's good to put them out there. We know we're helping more and more people the more we do it. So thank you again for joining me today, everyone. I'm Dr. Rob Van Bergen, and you are listening to Pain Free for Life.
Thanks for listening to Pain Free for Life. Be sure to follow us, share the show with family and friends, and leave us a review on iTunes. Every time you share the show, you are helping someone take their life back from pain. Visit painfreeforlife.com for more resources, including our free guides to microcurrent, the Hache protocol and inflammation, as well as our blog and online community full of people just like you, successfully overcoming all kinds of chronic and extreme conditions to live happy, productive, pain-free lives forever. And stay tuned for the next episode of Pain Free for Life.